let's just start from the beginning. Pregnancy. Pregnancy can be a really exciting time for growing families, but the truth is it can actually be really scary at the same time. So what advice can you offer for parents as they're preparing to welcome their little one in the world?
Sure. So a lot of times, I'll tell parents they want to pack early, just because you never know when the little one's going to show up. And you want to be really organized. You want to pack things for everybody. You want to take a practice drive to the hospital because your partner may be a bit nervous on the way there and get lost. And so you want to be really comfortable where you go in. You want to take classes ahead of time, whether you're going to take infant care classes, breastfeeding classes, sibling classes. Get those classes in early so that you really feel like you're prepared.
Is there anything that can happen during pregnancy that a woman, may not expect or may not understand?
Yes, there is. In the book, we have a lot of normal topics that everybody has, nausea, sore breasts, but there are some things that parents, aren't really looking at or might be surprised to know that sometimes at the beginning of your pregnancy, you may have some spotting. And of course, that scares us all. But some spotting is normal when there's implantation takes place. So when you are spotting, try not to get really nervous at first. Call your doctor, make sure you tell them exactly how much you're spotting, how often, and when it goes away. So that's something that people are really, moms aren't prepared for. Also, the hormones can maybe make us a little moody. So just sometimes. So, if we talk to our partner about that early, it might not be so shocking, but there's a lot of things going on inside. And, even though you have planned this, this pregnancy, and, a lot of people now, especially these days, are going through infertility problems. And so that's a whole new host of problems and worries that we didn't really go through that much, 30 years ago. And so we really have to deal with a lot more hormones when women are going through infertility and taking extra hormones, if they're doing IVF, different processes. So, there has to be a lot more support for women and families that are going through infertility, because we just assume, when I was 18, I got pregnant like that. No problem. But, families are not having that type of success now. A lot of women, are feeling like they have to climb their employee ladder, get to the top before they can start their family. And so, that may be causing a little bit more problems with infertility. So I don't think that they're prepared at all for the prospect of when we decide, okay, we want to have a family, that it not working the way that it does when you're 18. And so those women and families, because it really does affect the whole family, going through a lot more hormonal changes. Something I really like to mention, because people don't know about it or don't think about it, is, most people have nausea or morning sickness when they're pregnant. But there are a special group of us that go through severe morning sickness called hyperemesis. They really don't know what it's caused by. They say, oh, you have a high level of HCG, your baby's so healthy. And as you are puking your guts out 24 hours a day, you're like, yay, yay, thanks. Maybe just a little less healthy. When I had my son 35 years ago, I threw up one time. It was in the middle of a bunch of construction workers, but it was just once. And with my daughter 30 years ago, I threw up 24 hours a day for 8 months. And I started, I think, the day the stick turned blue. And it really was not understood at all then. And every time I was admitted to the hospital, about 6 times, and every time I went in, I would have a psych evaluation. Because at that time, they were convinced it was all in your head. And they would come in and they'd give me the same talk. Are you being hurt at home? Are you, did you not want this baby? And I'm like, I was 18 when I had my son, and it was not the greatest situation. And I threw up once. This is a very planned baby. I'm in a great marriage. No one's hitting me. I swear this is not in my mind, because I would stop it. I'm sick. I can't stop throwing up. But they really did not believe it. And now, thankfully, it is a known diagnosis, hyperemesis. But, they would really come in and they would shame you. Oh, you're back again. Oh, yeah, because this is where I want to be. And you couldn't stop throwing up, huh? Like, no, I didn't even try. I was either yes or no. I picked yes. And they would just, they really gave you a hard time. So now if you do know, I know that everyone still, I'm sure there's people out there that still think it's in your brain. But if you know someone that has hyperemesis where they're throwing up 24 hours a day for more than the normal 12 months, really support them, really talk to their partners and, tell them this is a real thing that she has no control over, because if she did, I promise you she would stop it if you could. So I think that that's something that's really was very misunderstood years ago. And I think that it still has that stigma where people just don't believe that you can be that sick. And I'm here to tell you, I really was that sick.
How would one of my daughters go about finding a decent pediatrician?
So there's a lot of great pediatricians out there, but everybody has different needs and things that are important to them with their pediatrician. So I tell people to, ask their friends, ask their family, go on mom's Facebook groups and mom support groups, and ask for, different options and, close to them. So it's really nice when you don't have to drive an hour to see your pediatrician, because you do have to go there a lot, especially at the beginning. But I always tell them, don't just take a family member's pediatrician and that's set, because you may totally want something different than what I'm looking for in a pediatrician. So I tell people to interview at least 3 pediatricians and write down what's really important to you. Is it their hours? Is that they're open on Saturday? How many patients do they see in a day? How much time do they utilize to see a patient and answer their questions? And I always tell people to write down your questions before you go see a pediatrician, because as soon as you get in there, they'll say, what's going on? Oh, everything's fine. And at home, you've got a notebook, with all these questions. They're like, okay, great, see ya in 2 months. So I always tell them, write down your questions. But when they go and interview them, which they're happy to interview, try and see what meets up with their needs, what's going to make them most comfortable with them.
So there are so many products available for our nurseries. Are there any specific items you suggest that we include?
Sure, I definitely have some favorites that I'll show you, but I want to tell you, you don't have to spend a fortune on your nursery. And things that cost more does not necessarily mean that they're a better product. Talk to other people. There's some really expensive products out there that you may feel like you must have that the babies don't even like. I tell people, don't spend a lot of money on a fancy bassinet, because the babies will hate them no matter how much you spend on them. So, you're going to have you're going to have so many clothes because you'll buy a ton everyone, grandparents, everyone will buy a ton of clothes. And everyone seems to buy them in the same size. So what I tell people is don't take the tags off. And what really helped me and a lot of my clients is I would use under bed boxes, under the cribs. And I would have, like, if the baby's tiny, I'd have preemie clothes in their crib. And then when I got 0 to 3 months, I'd have them in the under bed box marked. And then 3 to 6 months, 6 to 9 months. And then as you get rid of the preemie clothes that are too small, you put them right in the underbed box that are too small, and you take out the 0 to 3 months. Otherwise, you end up having all these clothes in different sizes, and they never wear them. And they're expensive. And so you really want to, I even got as crazy with my clients is when I do the laundry, I put the clean clothes under the dirty clothes, not dirty, but under the clothes that are in the dresser, because otherwise you're always putting them on top. You're always grabbing the same outfits. And then all of a sudden you're like, oh, this was so cute, and now it doesn't fit them anymore. So you really do not have to spend a lot of money. Go for comfort. Do not buy anything that has snaps on it. Everything now is zippers. Zipper outfits, they were the best thing ever invented. They even have some outfits now that have magnets, but I like the zippers better because still in the middle of the night, you're kind of not able to get the magnets to quite line up. So the zippers are great. So no more snaps. Some of the things that I really like is just a few of my favorites. I do really like Dr. Brown bottles. Moms will complain that there's too many parts to wash, but honestly, they really help with gas. It's, it is these parts, but you can get a Dr. Brown little contraption that you put everything in washed, and you put it in the microwave, sterilizes them. So, and you can even put them in the dishwasher. Don't buy a lot of 4-ounce bottles though, because they are out of them so quickly. And so go ahead and buy the 8-ounce bottles. So I do really like the Dr. Browns. One of my other favorite is everyone likes to swaddle their baby. I like this Miracle Blanket swaddle because their arms are in these little pouches and they can't bring the bag. Their arms are a little down here under these little pouches. And so they can't bring the swaddle up over their face. So that's why I really liked this. I used to like different ones, but then I found I'd go in and I'd see that the baby would bring the swaddle part up over their nose and their mouth. So I didn't like that anymore. This is wonderful. I love Dr. Karp's video of calming a baby. He has great calming techniques. Every mom and dad should order it and watch it. You can read the book, but it's easier to watch the video. So he has great soothing techniques, and one of them is shushing. So this brilliant man, and I wish it was me, invented a shusher. So when the baby is just overtired, having witching hours, won't calm down, you can go in a nice, dark, quiet room and play the shusher and kind of shuts them down, helps them relax. Otherwise, I was always drink water. So this is my new favorite product. And another thing, why didn't I invent this, is brilliant because if you have older toddlers, you've had them climb out of bed, climb out of their crib. It always happens. My daughter had 23-inch legs when she was born. She was out of the crib. So I had to keep lowering the mattress, lowering it, and putting pillows and blankets around it. And now, this wonderful person, this isn't the whole one, but this is called a dream catcher. And this is one side of it blown up. And then the crib goes in the middle and it has 3 or 4 other sides. So when the baby jumps out of bed, they fall on the blow-up mattress, which is genius because there are a lot of babies that do get injured falling out of their bed. And you can keep them in their crib a little bit longer because I am all for keeping them in their crib as long as possible. Because if they're too young and you're trying to get them in a toddler bed, they have way too much freedom to climb out of that bed and come in your room. So get a tent over the top, do whatever you have to, get a dream catcher, and keep them in their crib as long as possible.